Hey, everybody. Welcome back to Dental Unfiltered. I'm Matthew Brown. I'm here with someone different today. Dr. Vallow isn't joining us, but I have Dr. Sasha, and we're going to introduce a new segment to the listenership that we're really excited about. So a lot of podcasts out in dental like focus on just marketing or just business, and they're not very well-rounded. And we've been trying to be very well-rounded here at Energize. And we had a really good episode with Dr. Sasha about full digital workflow from scan to teeth in the mouth. And it did really well. And I think there is a lack of content out there for exciting, enjoyable clinical content. I think you guys are starving to consume it. After it was our third best episode of all time, and Sasha came to us with an idea that he wanted to do his own segment on Dental Unfiltered, and we're going to call it Clinical Unfiltered with Dr. Sasha. And when I say I'm excited about this, I am excited because I go to CE courses, believe it or not, as a marketer. I sit in and listen because I want to know what you guys do. And I went to a course in Philadelphia. It was a dental nachos course, which is always fun. And they were talking about packing cord and doing all the stuff. And when I say I was fighting to fall asleep, I was fighting it. I was trying to consume as much knowledge as possible. I just went to an event with Dr. Sasha in Florida that he ran and he spoke, and I was on the edge of my seat the entire time. I think there isn't a such thing as a clinical entertainer in our space, but I think Dr. Sasha is going to change that, and he's going to be the first clinical entertainer we've ever had. I think this is going to be something you guys are going to really enjoy. So, Dr. Sasha, tell us kind of what your plans are for this new segment, and kind of what was your motivation for approaching us to try to do this?
I'm so glad you came to that event. That event kind of embodies my current mission in dentistry. I remember, I know that feeling. You're sitting in the back of a lecture room and you're just like, you're prying your eyes open, and it's sometimes really cool stuff. Like you want to learn it, right? Yeah. It's like, I paid money to come here and learn this, and I can't keep my eyes open. And that's the rate limiting step, is like, can I pay attention to then ingest the material? And I was just like, there's got to be a better way to deliver content, to educate. I mean, back in the day when you would learn things, I mean, we had the whole concept of oration in the Greco-Roman world. People would like be talking and walking and talking outside. The ability to communicate knowledge, I think, has become almost cookie cutter in a way. Yeah. It's like, oh, you go up, you introduce yourself, and then you lecture and you talk about your credentials before you lecture. I'm out there to like flip that completely on its head and just kind of create a creative, new, fresh way of delivering knowledge, mainly just by keeping it entertaining. Because you watch a movie, your eyes are mostly open. You're pretty much ingesting everything. You remember you watch Love is Blind for like 8-10 hours. And Not you, Matt. Maybe not you, Matt, but a lot of people do.
My wife loves Love is Blind. And when I go on business trips, like if I'm going to be speaking somewhere, I'm like, what are you going to watch? She's like, Love is Blind because you're not here. It's not my show, but she likes that show a lot.
What I'm saying is that people could watch for 8 to 10 hours, but something that could change a patient's life, they can't even listen to for 30 minutes. So that was the concept. It's like, can I make dental education entertaining? And so that created that it was called Dental Show and Tell is the name of the CE event, with the purpose of just changing how we deliver education. To make it more fun, make it a show. I mean, I joked with you the idea of like hiring like B-list celebrities like Carrot Top to give our dental lectures, just to keep people awake so they can ingest the material. So with when we did the podcast, I had a good time. I was always thinking, man, it'd be so much fun to do a podcast. So when the opportunity, I saw how much traction you guys are getting and how much of an audience you have, and I thought about like starting it on my own. But you guys are my friends. I want to ride the wave with you guys, and I was like, you know what, this is the perfect platform to jump in and start doing some fun podcasts. But on the clinical side, you guys have the candid business conversations so well. And it's not my forte, but I will tell you, I am enjoying it more and more. As a nerd, I like to think that I can learn anything, including the educational side. And Matt, as you know, like I kind of brought this up at the conference. I kind of shocked him a little bit. Matt came and he was one of our speakers, and he spoke about marketing components. A lot of things, typically there are clinical based lectures, but his was from a marketing standpoint. At the end of his lecture, I came up and was like, I hate dental marketing. And Matt was like, oh, yeah. What? I had no idea. I took him off guard, in front of everyone. But then I reverted to say that through Matt, listening to Matt talk through the podcast, through other mediums too, just watching how that's flourishing in dentistry and how it's actually helping a lot of dentists succeed. And then also equate to patients' treatments, treatment acceptance of cases that they really needed to have done, just improving overall patient care. I've seen that, and I've seen marketing has the power to do that. And so I've completely flipped on that. And I was like, no, we need this. This is an important part of dentistry. It's allowing us to reach patients. And so I feel like having the two together, having the clinical component and the marketing and business components come in one podcast is a potent mix. Because, we'll talk about clinical things, but I'll also, even in the moments that I'm talking about clinical components of dentistry, I want to bring in I'm going to bring in a lot of different speakers. Goal is to bring in speakers, masters of their crafts, but also like Joe Schmoes. I want to bring people who are just doing dentistry, but love a certain component of dentistry and talk about that component of dentistry with them. Like Andrew, I'll probably talk about clear aligners with him on an episode. Is he the king of clear aligners? No, but he's good.
I mean, he's like blue diamond plus, I think. I mean, he's
he does a lot, man. It doesn't mean
he's a lot of clear aligners.
I'll humble him real quick. But I want to be able to talk clinically with those kind of people. But then with clinical people who are like deep diving in the clinical, maybe don't have the best business sense. I want to prompt them to talk about business too, to see how from that mindset, the clinical mindset, the deep clinical mindset, can they actually bring up components that have to do with marketing and business. For example, that's kind of like where I came from. And so I will play on both, but it'll be more heavily on clinical side of dentistry. And I don't want I do a lot of implants and bone grafting based lectures and 3D printing. And I'll probably do a lot of those episodes, but I want to bring it there. I don't want to leave a stone unturned. So I'm going to do all aspects of dentistry, and we'll hit them with little 30-minute episodes, 30 minutes to an hour, guests, sometimes me, sometimes case discussions. And when we do case discussions, we'll like post a video or a picture or slides that you'll have access to through links. And so you'll be able to follow along. But I will try to do, for all you guys like listening in the gym or in the car right now, I will probably try to give a visual description of what's going on for you as best I can, so you can just pick up on that as well and still get a lot out of those clinical case discussions.
Might actually have more contact with dentists out in the wild than you do. And what I find is that the world's very divided in dental perspective. And there's dentists that sit in the business seat and are like, they look at the operations of the practice and the business and efficiencies and look at where the dollars are and look at the better patient experience. And that's their focus, right? Andrew Vallow. On the other side, you have these guys that are like, I need a roll-into mill. I need this scanner because I can do this level of work. And they're spending a metric shit ton of money on CE every year, like way more than their requirement. They're doing these CE courses all over the world. I have a dentist on we have an elite team of dentists that I'm going to introduce you to. And Stephen is, Justinson, Dr. Justinson is really into lasers. And he's like really into laser dentistry, like really into it.
You make it seem like it's weird. It's like, it's too deep. Like, it's too deep.
Some guys go really
off his toenails. You need to stop doing that.
People get really into it, right?
Yeah.
And I think that we have the opportunity to bridge both sides of thinking. And it's almost the same as like stock. There's just a post made in Dental Nachos by Paul Goodman, who is probably one of the most important personalities in dental right now. Great guy. He made a post like about sales and dentistry, right? Like, are you salesy or are you an educator? I think it's both. I think there isn't a left or a right. I think there's a medium. But I think this is giving us an opportunity to bridge both.
Dude, I want those clinical guys, those deep-minded, I'm buying mills, I'm taking millions of hours of CE. I want them to come in, listen to the clinical things, enjoy it, and then be like, I do need to think a little bit more about the business, or it's kind of creeping into me too. And then on the flip side, I want those guys who's like the Andrew Valos, who's like, I'm business all the way, to start being like, how can I improve my clinical dentistry? I kind of want that to happen. That's my goal. Is I'm going to drive both of you into one sweet dental party.
The reality is the clinical and the doc is actually the product, right? So it's like you have to have some focus on it, right? And to be clear, I'm not a dentist. I'm not you guys. I'm an outsider. But I really geek out on digital workflow and stuff. I think we are living in the best time in clinical history ever. We can scan someone's mouth and inside the practice print everything we need or mill it and have a finished product that you as the dentist can oversee the quality of it from scan to delivery. and you can put it in your patient's mouth with a 99% accuracy. I mean, this is Star Trek. I mean, we're in a new world now of dentistry. I mean, it is so exciting to me, and I'm not a dentist, but I geek out on it. Like, I'm like, so we can print this surgical guide right here, and we can print these temps here, and we can mill the zirconia arch here, or this crown, and the patient's sitting right there. Yes, that's exciting.
I will tell you, that's scratching the surface. That's where we were like 10 years ago. It's just starting to become popular. And like, we'll definitely do deep dives on every component I'm just about to talk about. But where I'm at, what I think is the next wave of what we consider, and I'll tell you, a lot of these digital components, the whole goal is personalization of treatment. We're at customization of treatment, treating the individual rather than the one treatment for the masses. Especially with like digital scanners, huge. Components like augmented reality are going to come back with a big wave into dentistry, and they're going to intermix with AI. AI is starting to kind of work its way in as we teach it, and I see a future. I was just talking about it yesterday with my wife about, she's a big AI researcher, so she loves AI, and me and her will geek out about it all the time. But specifically in dentistry, a component where you'll be wearing these augmented reality glasses, look at your patient, and say, hey, while you're actively looking on your patient's head, say, hey, turn on the nerve. And boom, as the patient's moving their head left and right, you're seeing the nerve canal track on their mandible. So as you're drilling with your active drill in your hand, you can see how close you're actually getting to the nerve canal.
Wow.
Yeah, technology is completely out there right now, and they're developing it. That is like an active development. But that'll actually come to the masses, because I think the technology cost ratio, like, you'll be able to afford that relatively soon, and that'll just be a norm.
Augmented reality headset.
One of the limitations that we have right now are the augmented reality headsets. They're just too bulky, and the ones that we have that are more thinner profile, like the whole concept of Google glasses and things like that, they don't substantiate enough good visual field. Like, you can't see that well out of them to use them in a surgery. They're like small little square frames. Like, you need it to be your whole field of vision to really work it. And those HoloLens, Microsoft's HoloLens, is kind of the closest thing we got to having like an augmented reality glasses that does cover your whole field. The Apple Visions, those two as well, but the softwares too that have been developed, so those are getting better. Like the actual frame of what you wear, the actual like hardware that you wear on your head to see out of, they're getting better. The software is still not there also, but both of them are growing together. And it's like a matter of like a couple of years, if you ask my opinion, that we'll be able to do that. And it'll be to the consumer, like us dentists buying that and using it intrasurgically. And it'll be much cheaper than most other live guided surgery instruments out there. But, probably when it enters the market, it'll still be a pretty penny, but affordable.
That will disrupt the robots.
Maybe, maybe not. The robots control your hand. They're a replacement for your hand. The vision is for your eyes.
Okay.
Your eye component of being able to place an implant. Your accuracy is a combination of the two, being able to visualize and then actually physically using your hand. The robots eliminate that error. They eliminate your ability to have any kind of tremor, being off with your hand, pressure changes in the bone as you're contacting the bone with your drill. You run through different densities. It's not like a wall, like a drywall. It's this kind of thickness. With bone, it can be different, especially if it's grafted bone versus not grafted bone. Do they have more cancellous bone? Do they have more cortical bone? And where is it? And what kind of shape it? All that will affect how your drill progresses. But your drill is going to go through different densities, basically, and it can cause you to lose track. You'll lose, your drill will slip if you go through different densities, and you'll lose accuracy. The robot doesn't slip. The robot goes exactly where you planned it.
If your drill is too fast, there's too much pressure, can't you also burn the bone and like polish it almost?
Absolutely.
And that'll create a failure also, right?
Yeah. And that's part of getting good at surgery is you learn to play with your bone. I always tell people, design your osteotomy, don't drill.
With the robot, it eliminates that problem.
Correct. Yeah.
Okay.
Pressures is stabilized. The nice thing about if you add augmented reality to it, you are fact checking it in a sense. You're like watching it do the right thing.
It confirms that you're in the right place. It's a mental visual confirmation of like, I'm putting the drill where it really should be to avoid this sinus, this nerve. I'm going as deep as I should be going. My angle is right.
Yeah.
Everything is, it's a visual confirmation of the decision of where you placed your drill.
Yeah. And it's also going to be how you map it. So you don't have to pre-plan the surgery. You can open up look at everything in real time, then with your finger, essentially, or an instrument, maybe a pen, like a pen-shaped instrument, draw on the bone where you want that implant to go. And then the robot then can take over and do the actual tracking and motion of it. Now, the thing is, a lot of these companies that create, I don't think they've all talked to each other about these tech ideas. They're so kind of tunnel vision on their own products, and I don't think they've implemented all these crossovers of live guided surgery, augmented reality, robotics. But it's all coming. Like, all these tools are out there, and they will come together, just like 3D printing intraoral scanners and cone beams have all come together to create cool technology. All these other components are going to come together too. AI is going to make it easier.
It's an exciting time in dentistry right now with all the tech, and that's why this podcast segment we're adding for you is going to be so high and so valuable. Like, I'm really into reading about the AI treatment planning and stuff right now, and there's docs that are fighting it that don't like the idea of it, and it's not that it does your job for you; it's that it brings everything forward so you can do your job easier, right? And some docs are like, I've had docs like, it's infringing on their skill set. No, it's allowing you to spend more time on your skill set because it's bringing everything forward for you to see it. Like, you're misunderstanding the tool. I think right now we're in a time in dentistry, and I'm a baby. I've been in dentistry 5 years, very little experience, but I've watched, like, 5 years ago, no one had a CBCT. Now every startup I do has a CBCT. Mm-hmm. That is the new standard of care. If you don't have a CBCT, like, what are you really doing? Right? Like, you need to have one, right? And now it's like going towards, like, I'm talking to, I think it's Zomi or Yomi robots. Yomi. I'm talking to Yomi right now. I'm learning about the robots at Yomi, and it's just exciting. It's like, this is so cool. So getting back to the segment, Clinical Unfiltered, what are some of the ideas and episodes that you have planned for the listeners? Like, what things do you want to dive into? Tell me what's in your head as to what you want to give to the listeners.
Like I said, I want it to be candid, but I want you to be able to ingest the material and have a good time listening to it. So I want it to be enjoyable. And then also, while you're enjoying it, you happen to get knowledge slipped into that brain of yours. But topic wise, I mean, like I said, everything in dentistry and any crossover in dentistry that hasn't even entered dentistry. For example, these augmented reality concepts, they're in orthopedics more than they are in dentistry right now. But I want to be able to help that segue. So when it's coming in, you're like, oh, I've heard about this.
I wonder if the doc that did my leg amputation used augmented reality.
So I've got a foot into the AI research realm. Like, when they try them these days, it's mostly a disappointment. So it's few and far between the people using it. But yeah, I'm going to definitely, implants are going to be a big topic. I'm going to be able to bring a lot of content on that. Everyone loves implant talks. But I will tell you, like I said, I'm going to get into clear aligners, cosmetics, removable, nothing's going to go left alone. I do want potential suggestions too. So, like, every medium that we have to communicate with us, Instagram is a great way to get in contact with me. I mean, you could, like, at Perio Hero, you can just send me a suggestion. Hey, I would love to hear an episode about this, and I'll gladly dive into it. Respond to these podcasts and suggest ideas. I will gladly look and hunt for speakers or other people who are either subject matter experts or people who just love the topic, and bring them on, and we'll hash it out together and talk about it. But otherwise, it's, like I said, everything clinical I will touch. And anything, like I said, even just outside the rim of dentistry, as it peeks its head in, I'll touch on those too.
Awesome. So, like, if I'm a listener and I'm a new doc, just got my CBCT, I acquisitioned a practice, let's say 6 months ago, I'm doing my first CE course for implants. I'll be able to listen to this podcast, and by the end of the 30 minutes, my clinical knowledge will have moved significantly, and I would have enjoyed the process of it moving.
Correct. Yeah, you'll enjoy it. And I think in this format, you're going to get mostly pearls. You're going to get, like, unique pearls.
The pearls and gems term is such a unique thing to dentistry. Yeah. I spoke at the American Academy of Clear Aligners study club in Michigan, and, like, literally everyone did, like, there's so many pearls. You were showering me in pearls, and I'm like, cool. I'm glad you like pearls. Yeah. I was like, it's so weird to me. Like, it's such a unique thing in dentistry, pearls and gems.
You think about it like, are you going through a fundamental lecture, or like where you're learning about the basics and the fundamentals, or are you going through a series of
Well, like
lectures where
tips and tricks.
tips and
Like,
tricks? And I'll tell you,
yeah.
if you have some experience, most of the time, like when I'm going to the American Academy of Periodontology, I'm going for pearls. I'm doing perio every day in and day out. I got the fundamentals down. Now I'm looking for pearls. So I think through the podcast medium, we'll get a lot of pearls. Don't get me wrong. We'll always have to touch on the fundamentals, but the pearls, I think, will be the biggest benefit.
The pearls are things that move the needle, right? So it's like,
Oh, yeah.
like I'm doing basic perio, or I'm doing basic clear aligners, or I'm doing basic implants, right? But then like this one pearl takes my efficiency from here to here, and the next one from here to there. So all of a sudden, my 50-minute implant placement can become a 20-minute implant placement because of the 4 pearls I got from Dr. Sasha, and it moved me forward. And I actually enjoyed listening to it. I didn't fall asleep. Like, we don't want to listen to it when you go to bed at night to help you fall asleep. We listen to it on the way to work and be excited for the next episode.
Exactly. Let's shower some pearls.
The shower, pearls. Pearls. I almost said something. Those kind of.
I was about to say.
Yeah, pearls for everyone. So this is really exciting, guys. We're really up for. We're going to wrap the episode here in a second. Dr. Sasha is a periodontist down in Florida. He's partnered with Dr. Vallo on their implant and full arch practices. Those practices have grown rapidly. They just did a startup recently that month 1 did like $230,000 in collections. That practice, that startup that had a remarkable first month, is a blend of the DNA of Dr. Vallo and Dr. Sasha, setting up the right clinical process and getting everything in place right for the docs to be efficient, be able to do their job as best as possible and to be as effective as possible. In the military, my background, special operations, like I worked around the Green Berets and stuff a lot. I spent a lot of time with them. And the reality is you can give someone all the best equipment in the world. But if you don't improve the human equipment and get that skill set up to where it needs to be, it's all kind of a waste, right? And what I can tell you is the startup opened month 1, did $230,000 in collections month 1, and the docs were uber effective at their jobs. And I've been to this practice. I spent a day there. I shadowed them. And when I tell you that these guys are good, they're good, and every tool they need to be the most effective versions of themselves is available to them. So when I say Dr. Sasha is a knowledge wealth, I don't know this to be true. Dental Intel is trying to get the data on this, but we believe that might be the most successful first month implant startup in history. So the knowledge you're getting from Dr. Sasha is clinical, but those efficiencies in the operations and the effectiveness of you is what creates way more profitability.
Yeah, and you know what? Again, I think that's where the pearls come in.
Yeah, the pearls move it. Yeah, the pearls create efficiency.
That's the mindset I'm coming from. As much as I am like a clinical, I love the deep knowledge of how we do the things we do in dentistry. I am a clinician who practices in an office, and I'm not like a big time researcher. I'm not a professor at a university. I do lecturing sometimes, but it's more like, like a fun based lecture. And so that's my mindset is like, okay, we got to be like, I got an hour to do this procedure. I got 2 post-ops to look at next door. And then I got a consult on the side of a surgery. So I want to do awesome work, but I got to do it efficiently. And that's where my mindset comes from. And that's what I'm saying. I want to bring masters of their crafts in here too, but sometimes those guys have excessive amounts of time to do their procedures. They're perseverating because they're purposely recording it or it's for research. And I love that, but I also want to bring Joe Schmo is probably a little harsher of a term. People who are masters of their crafts in clinical practice are the ones who are masters of efficiency. And I want to bring those guys on here too, to talk about how do they get their clinical workflow efficient as well as awesome.
We're going to wrap up here just in 1 second. What I find too is, and you're the pro, right? But like, I find a doc who has invested time in his workflow, has built the workflow and the infrastructure he needs to be very, very effective, also turns into a doc who chairside educating or selling, whatever you want to call it, is very confident in his communication to the patient because he knows I've done this. I know what it is. I know my accuracy level. I know I can produce a good product. I know I'm the best choice for your care in the area. Let me scan your mouth and change your life. And I feel like the doc that has invested their mind in that is like, yeah, we can do it. We do it every day. This is what we do. Docs who haven't are like, we can do it. And they send it off to a lab and it goes in this mysterious cloud out in the world and there's lab problems and it comes back and it's not the right shade or doesn't fit right or something's off by a
You don't
millimeter.
know why.
You don't know why. Was it when you talk to the lab and you're on the phone and there's no visual context and you're trying to explain it and it's a giant mess. But when a doc says, hey, I'm going to buy this scanner, this mill, this 3D printer, this software, build this digital workflow, I've ran it, I've tested it, it works. Now they're in the operatory in front of the patient and they're like, you don't like your mouth. I'm embarrassed by my mouth. I hate it. Life's uncomfortable. Let me gift you a better mouth. Let me be the person. And I'm confident I can do it. And when they're with that doc, they're willing to spend more money. When with the other doc, that seems a little bit unconfident and says, like, listen, the first run may have some problems. The lab's not always perfect. Does not give you confidence.
I think you hit that point too, is you're going to get to play. The more confident you get, get out there and play. We're going to have fun.
Become the quarterback of the dental procedure. Control it and run it, and run the play the way it needs to be ran, and have confidence your team knows how to run it because you built the infrastructure. So, hey, this has been really exciting, Dr. Sasha. I am super excited about these episodes. I know that the listenership's really going to enjoy them because I've seen you speak. It was great having you on today. Before we go off, is there anything left you want to say?
Guys, I am so excited. Let's have fun. I can't wait. Fun. Yeah. Give me your ears. Give me your heart. Let's go.
I am so pumped for this. Hey, guys, we don't do sponsorships. No one is paid to do this. Me, Dr. Val.
I'm not getting paid.
You're not getting paid. $0. We really don't want there to be like any financial motivation in what happens at Dental Unfiltered. Like even my company, Energize, we try to never say the word because we want it to be like purpose built for the end user, like improve you and an investment from us to you guys. So please click like, please subscribe, please share, please leave a review. We do read the reviews. I promise you we do. Thank you guys for joining us. Have a great day.